ask you, I think you brought up a point in terms of suicide, and I have a case that has been brought to me in one of my constituents in Eagle Pass, that young lady who either was killed or accidentally died or committed suicide, and the way she was treated after she came back from the VFWs, number one, when they commit suicide in the military, the family gets no compensation whatsoever, no resources. They get treated very as if they were cowards. And I'm curious to know, you gave me the data on the number of suicides that occur afterwards. I'm wondering if anybody has any information on how many possible suicides we have during, and the possibility of doing those tests while they're there, and if you can, react to that.
Yes, that brings up a very important point. What would be ideal from a scientific standpoint and a clinical standpoint would be to do testing pre-deployment. Testing after the soldier's been accepted into the military, before they start their training or during their training, to get some kind of a baseline. With the kind of test I mentioned, we could identify people who might be at high risk of suicide. If it wasn't proven yet, we might, they would go out into theater, but then we'd actually have a chance to find out how accurate our predictions were. When they're coming back is a key time to test them. After someone's been injured.
And if I can just follow up on that questionnaire that you had with those 3 questions, would that be something that could be utilized for the existing soldier that's out there right now, and would that be viable?
Yes.
Okay. And one additional question, if I can. You mentioned also institutionalized, but I've always been concerned that no one ever talks about these soldiers. 80% of our people that are in our prisons throughout this country are due mainly for drugs. And a large number are medicating in some cases. If anybody is aware of any kind of studies that have been done on the number of veterans that be in our institutions because of drugs related, and any kind of assistance in that area?
That's a group I would love to study. In California, we've started a reform process under Governor Schwarzenegger to change the Department of Corrections to the Department of Corrections and Rehabilitation. And I'm hopeful that in that process, soldiers will be identified who can be rehabilitated and possibly removed from prison, and that we might, during that time, be able to find out how many soldiers are in our prisons. It's a significant number, and it's tragic.